This is John Lohr. I'm here today with Dr. Amui-Bellon to discuss some issues of menopause and a treatment that the doctor has. Could you share that information with us, doctor?
I'd be glad to. So when women go through the menopausal transition, and this is something that most women talk about, they experience hot flashes, receding hairline, the hair turns gray, the skin is less supple, the breasts sag, they begin to have certain medical issues, osteoporosis and other things. But more importantly, women also go through vaginal dryness because their hormones are no longer working the way they used to when they were in puberty and after puberty. So once the ovaries stop making estrogen, the tissues that respond to estrogen or give feedback to the body to produce moisture begins to decline. And these women begin to have dry vaginal tissues and painful relations or painful sexual relations. And these women tend to suffer in silence. They don't talk to their friends or physicians about it because they're embarrassed to talk about it. It's a taboo subject because it's sex. But this is an important aspect of a woman's life where in this day and age women are living for very long lives. 88 is the average leading age for women, longevity. And so if sexual intimacy is important to the woman, I think it's something that they should address. Now, in this day and age, we use hormones to treat this. We also use certain selective SSRIs to treat these conditions as well. We also use serums to treat these medical conditions. But there are some women who are not candidates for these standard treatment modalities. So certain women are not going to be good candidates for hormonal therapy or serums or Sphenia or SSRIs, for instance. So there is a non-hormonal alternative to treating vaginal dryness. And if women are finding sexual intimacy important to their relationships or important to their lives, then it's something that I think they should nurture. So there is the Mona Lisa touch, which is vaginal laser therapy that is delivered to the vaginal walls. It's similar to the annual pap smear that a physician does in their office. It's virtually painless. It's about 5 minutes long, not even. And we deliver micromillimeters of fractional laser therapy to the vaginal walls, and this helps to restore vaginal moisture. The moisture makes a big difference in these women's lives because in recruiting, when you deliver the pulsed laser therapy to the vaginal walls, it recruits blood vessels to the vaginal wall, supplying moisture. And in doing so, it also recruits other things that go with the blood vessels, for instance, elastin and collagen. This laser therapy can also be delivered to the external aspect of the vaginal or vulvar tissue that also restores the vaginal wall and elasticity and collagen to those areas. And this helps to restore vaginal moisture and sexual satisfaction.
Thank you for sharing that with us today.